My name is Dr. Rakesh Amin. I'm a consultant paediatrician who specializes in diabetes and endocrinology. I chose to become a doctor during my gap year between my A-levels and starting university, and I went to India for around a year, and during that time I saw the differences in people's lifestyles and illnesses and decided that's what I wanted to do. I always envisaged I would then be a doctor in the developing world, but as things happened, it didn't work out like that. Part of my challenge was that I loved almost all aspects of medicine, and therefore it's quite difficult for me to narrow down which specialism I wanted to study, and I include being a GP in that as well. And so it was more events and luck that led me to be offered really interesting jobs, which then in turn led me to specialize in this field. The most rewarding thing about my job is the people. And so I would include both the patients and families, because I'm a children's doctor, but also my team, the people I work with. So the children and young people and their families, that's probably the best part of most doctors' days. If you're a people person, which I am, and establishing long-term relationships with some of these people who have long-term medical problems. And I'm largely based within the NHS, which is a very multi-ethnic, diverse workforce. We have a great team, we're very close, and I enjoy seeing them every day as well. So part of our challenges recently have been a lot of remote work, and it's always great to see people face to face. Okay, so I would hope my patients and the families and the parents would say I'm open and transparent and honest with them. This is easy when you have to give good news, but it's more challenging when you have to give bad news, and any doctor shouldn't shy away from such things. And I think overall that is appreciated. I'm also, I would hope, come across as warm and empathetic, and good at establishing relationships. And I would hope, where I have to see families for many years, and that's often the case, that they, in a funny way, enjoy coming to see me. So in my team in the NHS, and I try to apply that in my private practice, we say, let's get it right first time. So we're very thorough. I hope I'm very thorough, and that rather than a third and fourth attempt of trying to figure out what the medical problem is, we put more effort in and get it right first time, and that pays off in the longer term.